Hello students, I'll show a very typical clinical condition, swelling, and identify this one please. Or differential diagnosis, look at that, there is a swelling well localized, red, with some sort of looks like a neoplastic condition. So this is a very typical, look at that, what are the possibilities? Important thing, first thing you have to think of is skin adnexal tumor, dermatofibroma, maybe pyogenic granuloma, not that typical because there is granulation tissues all different. Our look, it's not look of granulation tissue actually. Maybe SCC, that's also that typical. But first two are more likely. In that skin adnexal tumor is the mostly. Second, definitely possibility is a dermatofibroma, can't rule out. So these are the two possible diagnoses. Look at that, you can make out. This is so typical. Skin adnexal tumor, first thing you have to immediately should come into your mind. Next is dermatofibroma, remember. And skin adnexal are sweat glands, sebaceous glands, and hair follicles. You know all three types. And tumors are not uncommon, can be benign or malignant, common in the scalp, face, and limbs. Anywhere it can occur. Regional nodes should be examined in the head and neck, head area, neck nodes, in the limbs, axilla or groin, and can be multiple, often associated with the syndrome. Biopsy, which is a must. Tumor marker, cytokeratin, epithelial membrane antigen, and CA are done for identify the subtypes, specific types, and nodal ultrasound and FNAC important. CCT of the area and region are the needed additional investigations. Treatment is wide local excision, regional node dissection. Adjuvant therapies like chemo and RT is a must. MOHS is a short note for you. Micrographically oriented histographic surgery, the full form. Laser, imically, photodynotherapy are the other useful therapies. Dermatofibroma, again not uncommon. Remember, cutaneous tumor, benign tumor, common in females, arising from the dermal dendritic cell. That is MCQ question. Cartwheel appearance is very typical. There are the different names. They are for that. Sclerosing angioma, subepithelial sclerosing, benign nodulous fibrosis, dermal histiocytoma. Treatment is excision should be sent for biopsy always. So read my clinical methods in surgery to how to examine skin tumors. My skin tumor topic, separate topic is there, chapter is there in manual of surgery in detail about all these things are discussed. Surgical operation which gives a different excision, wide excision and rotation flaps to cover it. Tissue abrasive or suturing technique, my DigiNow lectures to JP publishers, everything is covered. Basic undergrad syllabus, CBME, then specialties, X-rays, instruments, operative surgeries, specimens, and clinical examination videos. So you can always subscribe for 1 year and give a very clear idea about entire surgery topic as you wish. So students, I hope this skin tumor you understood very well. Thank you very much.